our colleagues here at the clinic. So we're here today to talk to you about a transformative healthcare initiative. We feel that with respect to reducing the incidence of cardiovascular and kidney disease, this is the most important healthcare initiative ever in our community. So to explain our vision, I would like to introduce Dr. Kadri, our medical director and clinical research lead. Dr. Kadri saw the need to change the way specialty care is delivered in our community, and he began campaigning in 2011. So please welcome Dr. Kadri.
Thank you. Thank you so much. Thank you all for coming. A lot of you are not just colleagues, but friends, and so I really appreciate you being here and showing your support for this. As I look through the room, I feel humbled to have you with us here in what my wife often refers to as my second home. So I want to start off by thanking our staff here who have been working very hard over the past several years to help us with our vision. I want to thank my wife Noelle, who's put up with a lot of complaining over the past few years and a lot of long hours. Nicole, thank you so much. Nicole's been a fantastic addition to our organization in helping to try and move this vision forward. As I look through the room, a lot of friends. Eddie, who's a former mayor, who is a close friend of mine, always been very supportive of the medical community, helped so much for Dunks for Dialysis, and helping us to raise money. So Eddie, thank you for being here. My good friend Taysir, who I grew up with here in Windsor, Dr. Abu Hassan, who is now an endocrinologist here, who we go back to when we were both in diapers growing up in South Windsor. Dr. Al-Masri from the university, Derek, who works with us within our renal program, Tim, who's been a friend since I've started working here in Windsor, who's the president of DCMS right now, Jerry Cooper from Schulich, who's just been a fantastic advocate for medical education in our community. And we're just talking at the back of the room how it's really transformed the healthcare milieu in Windsor and Essex County, having the satellite medical school and what it's meant to the community. Tony Toldo Jr. And Chris with him, thank you for being here. I mean, your father and yourself, such great advocates for improving healthcare in our region. Really appreciate it. Alec Anderson from the Lynn, thank you for being here. Alec, you've been such a great supporter of what we've been trying to do ever since we started this a few years back. Jack Spears and Carmen Anicello, who I've worked with for over 15 years at the hospital. Two finer physicians I do not know of. Two more dedicated physicians I do not know of. Also, advocates for improving healthcare in our region. So thank you for being here. And Marilyn and Helena were here. Thank you so much for being here. The Rakavitas family, everybody knows Tom Rakavitas and what he meant to our community. And I think everybody's aware that he recently passed. But before he passed, he tried to make such a huge difference for the life and well-being of dialysis patients in our community, and Helena and Marilyn right there by his side trying to raise money, and on behalf of our foundation I want to thank you so much. You know, we have chairs that are now in our clinic that patients will be able to use that are much more comfortable, and that's all a result of their efforts and Tom's wishes to try and not only improve his own situation, but he felt really strongly about helping all of the other patients that were going through the same thing. And so thank you for being here. I apologize if I missed anyone else. I just wanted to really thank you guys for attending tonight, because this is so important to us. We've been working very hard at this for several years. Our goal, first and foremost, is to find a way to make improvements to our current healthcare system that will allow us to provide more efficient and more effective specialty care for high-risk cardiovascular and kidney patients. That's been what we've been about for the last few years. We saw gaps in the system that we felt needed to be addressed. We have a lot of talented specialists in our community and primary care practitioners. But we felt that the system could be improved to try and help coordinate care better, to try and help improve outcomes for patients who are high risk for cardiovascular and kidney disease. And that's why we started working on this. You know, our primary care partners are the most important people in providing care for patients in this community. They are the quarterbacks of the system. It's our job as specialists to provide them with comprehensive care maps for their patients to allow them to do their work more effectively, to allow them to help enlist patients in adopting therapies that we know can make a huge difference in reducing cardiovascular and kidney disease. And we see primary care practitioners in our community as playing a central, pivotal role in helping us achieve our objectives as an academic research institute. Along that line, several years ago, we felt a need to partner with the University of Windsor to become more academic, more research focused. And that's when my good friend, Dr. Maher El-Masri, and I started collaborating, communicating, and started to embark on doing more clinical research. And I can tell you, as a physician working in this community, without someone with the expertise that Dr. El-Masri has, doing research is very difficult. He was like a godsend. We'd have ideas and we wouldn't know where to take them. And he would show us the path of how to get there and how we could do research in a community like Windsor. That research didn't need to be confined to academic centers like London and Toronto, that we could do it here, and we can do good work here, work that makes a difference, work that people in other centers began citing. So that's really all, the credit for that really goes to Dr. El-Masri and his passion for getting involved in medical research, and it's been a tremendous, tremendous partnership. And that's what we really want to do. We want to establish an academic research-focused institute that will help us provide more comprehensive specialty care, coordinated, efficient specialty care for patients. And we think that that is the way to go, and we feel a single site, comprehensive, multi-specialty, multidisciplinary center is what we need to do. And shortly after we began evolving this in 2011, we were very pleased to see that the Ministry of Health endorsed a vascular health blueprint for Ontario that had all of the principles essentially that were in our model. So we knew, it confirmed that we were on the right path. And so we were very happy to see that. And then with our model that I'm going to explain in just a few minutes, we're hoping that if we set this up properly based on the principles that we believe in, when putting patients first and looking at the challenges that patients have and trying to help them overcome those challenges, that we can come up with a model that could be extrapolated in other parts of the province. Well, this is innovative, it's new, we're very proud of it. We think it's something that really doesn't exist anywhere else in the province, and if we can prove through appropriate academic research that this makes a big difference, and that's what we're looking to do, hopefully this is something that other communities will be able to adopt as well. So having said that, I'd like to go over the model with you. Okay, so the need, there always has to be a need. We wouldn't want to change anything just for the sake of changing it. What we've noticed here over the years, and I'm sure you've all heard this, that in Windsor and Essex County, we have among the highest rates of cardiovascular and kidney disease. And as a result of that, we see a need to try and do things better. And we think in order to do things better, that the system itself needs to be transformed based on the available evidence to transform it. And so, so we feel the system needs fundamental change. Now, when we look at a patient, and in a minute you'll hear from one of our patients, but I can tell you on a daily basis, I have patients in my office that have multiple medical conditions coexisting together. Sorry, I'm on call. But patients with vascular disease tend to have multiple coexisting medical conditions. Tim can attest to this as a family doc. Hypertension, diabetes, heart disease, heart failure, chronic kidney disease, mini strokes and peripheral vascular disease tend to happen concurrently in the same patient. One patient may have 4 or 5 of those conditions that they're trying to manage at the same time. And their journey through our system currently is quite onerous. And honestly, if you a doc that's ever dealt with these types of patients, you hear it when they come to see you. You feel it when they tell you what they've had to experience. Care where they'll see their cardiologist at one point in time, and 3 months later they may see their nephrologist, and 2 months after that they'll see their diabetic specialist, and after that a vascular surgeon, and after that an internist. And each of those visits tends to be very siloed, right? Records aren't really shared in real time. Each visit is tagged with different lab investigations or imaging tests. It could consume all of their time and energy. And people regularly in front of me say, I spend all my time seeing doctors. And geez, I really wish our doctors would talk to each other. One doctor might stop this medication, another doctor will get upset and say, no, you should have started that, you should have been on it. And so that communication, even though it's well-intentioned, sometimes when it's not optimal, things can slip through the cracks. People can end up in emergency rooms, and people's conditions can deteriorate if the access and timeliness of care is not optimal. And we see that happen all the time. We see the strains on our emergency rooms, and on hospital admissions, and on families and family members that have to deal with that. And our goal is to reduce that burden on patients and their families by trying to coordinate care at a single site, multi-specialty, multidisciplinary center, where a lot of that can be made more efficient and hopefully more effective for patients. So to give you an example, if I see a patient in my office for their kidney disease, and I think their kidney function's stable, but as I'm examining them, I say, geez, you know, it looks like your heart failure is getting worse. Instead of waiting 3 months to see their cardiologist at their next scheduled appointment, they could see them down the hall that same day. Instead of having duplicate lab tests for every doctor's visit, that they could come once and it would be shared with everybody. When they come and you have a single electronic medical record, any change that's made is visible in real time to any other physician that's caring for that patient. You know, we're looking to make things more efficient and more effective for the patient. And any model, if it's going to be effective, it needs to start with the patient in the center. It needs to be patient-centered, not provider-centered. And that's what we really need to shift to, is that type of thinking. So our current healthcare system, as I mentioned, you know, oftentimes because of, you know, a lack of optimal coordination. We have such talented professionals in our community. I think a lot of times we're just looking for better ways to do things to help our patients more. But because of the lack of optimal coordination and timeliness of access, we notice that it leads to increased ER visits, increased wait times, inaccessible files, polypharmacy. You know, patients on more medications than they need to be, adverse reactions as a result of those medications, discontinued preventative therapy. Did you know that we have so many therapies at our fingertips to help reduce cardiac and kidney disease, vascular disease, reduce heart attacks, strokes, heart failure, progression of kidney disease. But only about 50% of patients are on the therapies that they should be on, because a lot of times they're discontinued for one reason or another and never restarted because people don't know why they were taking off of it in the first place. A lot of times it centers around an ER visit or a hospital admission, and things that could save people's lives and improve their quality of life and longevity are no longer therapies that patients are on because of that. Duplicate labs and imaging and increased acute complications. These are things that if you work within the system, you see happening regularly, and we see the need to change that for the better. It's not that what we're doing isn't good. It's that what we could be doing could be better. So our vision centers around trying to focus on trying to improve patient outcomes. About 1/3 of all deaths in our region are due to cardiovascular disease. That's the #1 reason for ER visits, hospital admissions, and it's the biggest expenditure to our healthcare system. We need to do a better job for patients, but we also need to do a better job for our healthcare system, because it's one pie, right? And if we can be more cost effective in the systems that we have and the care that we provide, that leaves more money to do other things better. And that's what we're looking to try and do. And, you know, we believe this needs to be done in the context of an academic-based research institute, because anytime you make a change is a golden opportunity to research it prospectively, to look at what effect has that change really had. How have we done better? How much have we done better? How much potential cost savings have we had to the healthcare system? That's what we're really looking to do. We have a 5-pillar model of care, and as I mentioned, it starts with the patient in the center. Patient-centered, accessible care. We don't want wait times for patients to be seen by specialists. We feel that if there are no wait times, we can dramatically improve patients' quality of life and longevity and reduce the burden on the acute care healthcare system. Prevention and wellness focus. We need to change our focus from treating established disease. Once you have a heart attack and stroke, of course, you want great care. But our goal is that you never have one in the first place, right? If we can do our job more effectively, then we can prevent an increased percentage of heart attacks, strokes, heart failure, and kidney failure. Not only will it be helping people live better lives, longer lives with their families, but we can also save our healthcare system quite a bit of money. Enhanced coordination of care is an important pillar, and I think I've explained that. Academic-focused research institute, that's what we're all about, and that's what's different. We're a community that is focused on community healthcare delivery. I think we need to shift from that, and I'm so glad Jerry's here, to become more academic, more focused on teaching medical students, nursing students, getting them interested in research, and changing the focus of trainees and established physicians from treating acute disease, which we all do very well, to helping patients adopt therapies and follow care plans that can help prevent disease in the first place. And again, cost effectiveness with quality assurance. That's a key component of any change in any system, and that's as well what we're looking to do. So, who are we? We're a nonprofit, and we'd like to become a center of excellence. Academic, evidence-based research institute. And we want to have a collaborative, and I emphasize collaborative. We want to work with everyone in the healthcare sector that's relevant to helping us achieve our goals. And we want to be community-based. We believe that's important to promote a culture of wellness, to promote increased accessibility. We want to better support the central role of primary care docs in our community and improve coordination and access and research the impact of a novel integrated model of care. And you know, these are the components of the model that we're looking at, with a primary care doc in the center, the different specialists working together. Imagine that you have a very complex case and I'm seeing you in my office. Wouldn't it be nice if I could, if I could bounce ideas off my colleagues in real time? We could have cases that we review on rounds together to make the most optimal management decisions. That kind of environment fosters research ideas. It fosters collaborating in the best interest of patients and the community. And so we believe strongly in that. A shared electronic medical record and database, a quality assurance committee, and again, very importantly, a single site, a center of excellence that's dedicated, that's focused on improving cardiovascular and kidney care. We've been very fortunate. We passed our model of care through the LIN, the Ontario Renal Network, and they've provided us with letters of support, which we're so grateful for. It just tells us that we're on the right path, our ideas are sound, and as I said, the Ministry of Health has endorsed a similar model through the Vascular Health Blueprint for Ontario. And so, and that's this paper that was published in 2012. And so we have this all on our website. If you want to get more detail about it, read our position paper. It'll take you about a half an hour to read it. Don't read it before bedtime. But it's all there if you need a little more detail on it. I want to thank you all for coming and listening to the presentation. This is our coming out party. We've been working at this quietly for several years. We've been working with our partners at the LIN, with colleagues, with the university. I want to thank Healy Tank in the back, a medical student who was very interested in doing research, and she approached us and said, can I do research with you? And you know, our position paper, a lot of the evidence behind it, Healy worked very hard during her summer vacation to gather all this relevant studies to support our position paper and provide it with the appropriate evidence. So Healy, thank you very much. I want to acknowledge you. I think, Nicole, I'm not sure what's next on the agenda, but I have to get out now. So, thanks a lot for listening.
Okay, so the next person I'd like to introduce to speak is a patient of ours, Bonnie Desjardins, a very wonderful lady who's coming here to share her story with us. So please come up.
Did I just stay over here?
Come on up.
Hi, I'm Bonnie Briesacker, and I've been a patient of Dr. Cadry's for the last 13 years. I've had the utmost respect and confidence in Dr. Cadry's office, team, and the man himself. As a patient struggling with kidney disease, I can honestly say I wouldn't want my place in anybody else's hands. Under Dr. Cadry's care, I have been able to live and possibly in my first diagnosis. Although I have stage 5 kidney disease, I've been fortunate enough to have it becomes a nuisance. Having to drive multiple places, I can only imagine the struggle those people who need the other specialists must go through, making visits across the city and waiting months for appointment. Now the new facility, I feel like Dr. Cadry and his team have a passionate and would be an astounding asset to the city of Windsor. I am truly honored to be able to speak of my experience. Can only imagine the good that will come from that adventure.
The research that we do.
Thank you, everybody. I have to start saying the first time I was introduced to Dr. Cadry was like 5 years ago. I got to introduced to him by one of our colleagues, pharmacists, who knew me through some research we did. And he expressed interest that, you know what, we might have a research study we'll be doing with Dr. Kadri. I've done research with physicians before, and usually it's a study we do and then we keep going on with our lives. That was not the case with Dr. Kadri. We did the study, and I saw something unique about the work that we did together. It wasn't research for the sake of research. I really felt the passion, the need for evidence so that it can inform practice. We've done the study, we got it published, and then the next comes, and then the next comes, and we started to think even bigger about the importance of research for patient care. And this is something I really live every day. I'm not a practitioner, I'm an academician. I work at the university, I'm a researcher, and I do research to inform practice. That's what I always teach my students. We do research for evidence-based practice. We don't do research to just get publication and get the fame out of it. So I was really excited that finally we have in Windsor what we can call research that will be sustained. Because to be honest with you, and I see some physicians in the room, when we sometimes go to meetings outside of our region, like in Toronto or Ottawa or elsewhere, Ontario ends at London. You know, like research almost happens everywhere between Ottawa and London, and then Windsor does not exist on the map. Even if we are doing good stuff, it does not get to be carried there. And I'm looking forward to the opportunity to continue this journey and hopefully have Ontario end or start by Windsor rather than end at Windsor. So I look forward to working with Dr. Kadri and the team. I really, I cannot tell you how much encouraged I am by this initiative, what it means to us in the university, our students in the medical school, something I care about passionately because I teach in nursing and medicine. I also think this is wonderful for the community at large. Like, I don't want to repeat what Dr. Kadri said, but this is a very unique model of care that focuses on prevention, bettering the quality of life of our patients rather than having to have them be at the mercy of the providers. So thank you for the opportunity, and I congratulate you for all the work you've done.
Thank you, Dr. Masri. Okay, so next I would like to introduce Alec Anderson from the LIN to come and say a few words.
Thank you. So I wondered what I prepared today in coming in. I've been working with Al Kadri about 2 years now, so we've been doing a lot of work in the particular area. So I thought I'd give a little bit more of an applied example so you can see how important this work really is. So we've been doing a lot of work around chronic disease prevention and management, and specifically we've been focusing on COPD, CHF, diabetes, and stroke. So we've been doing a lot of work in those particular areas. And what I find in my work and day-to-day and working with my colleagues, to repeat some of the messages that were already said today, but there is quite a lack or a dearth of data and research. So when we're trying to make decisions, we don't sometimes have really good information that we're seeking. So what we tend to do is we tend to focus on utilization. So we look at how many people are enrolled in a program, what was their length of stay in the program, if they dropped out, did they re-enroll in the program. So those are the types of information that we tend to collect. And what happens when you don't have good information is that programs generally start off on a pilot level basis, and you're not really sure if you're getting a good return on your investment or what you should be investing in. So what we're seeing nowadays in chronic disease management around those 4 disease entities that I mentioned is that we have new service models emerging. So we're seeing a lot of new service models and program proposals coming on the front. So we ask ourselves, what should we be funding as a LIN organization, and at what level should we be funding it at? So those are difficult decisions for us to make. In order to make those decisions effectively, we need good information. So I believe that to help us make those decisions, an applied research tool would be very useful for us. So we've had quite a few discussions over the past 2 years, so I think we're heading in the right direction. I think we need more of these type of tools so we can make better informed decisions. So we believe at the LIN that our decision processes should be objective and evidence-based, so we support those directions. We also think it's important to be able to measure results. So I get a lot of proposals in or requests for funding in, but we're not sure how we can measure results around those particular directions, so we need to do a better job at that. We also need to determine better what is our overall return on investment. So if we invest $1 in one area, area A or area B, I mean, at the end of the day, we're looking for the best return on investment. So that would be an important qualifier for us. And finally, we're trying to determine what the impact of these new models of care are on, as Al had said, the patients, both in terms of the quality of life that they're getting from that, and also health outcomes. So we're heading more toward health outcomes. That would be at a patient level. At a system level, specifically, we're interested now in utilization. That's what the Ministry of Health is directing us toward. And what that means is we usually track emergency department visits, repeat visits, hospital admissions, readmissions, and hospital length of stay. So that's not the most effective way to do planning for healthcare, because what it means is we're focusing on the symptoms in the healthcare system, and we're not focusing on the root causes. And I think we need to get to the root causes, and I think it's through an institute like that that we'll be able to get there. So going forward, I think that this research work will be an important partnership with the LHINs. I also think it'll help us to make decisions on funding, more effective decisions on funding overall, and also to measure the patient level results. We need to get a better idea of what type of results that we're getting in terms of the patients that we're treating, and also determine if we're getting a good return on investment. I tend to repeat that one because it's important nowadays, as we all know. And if there is some potential savings and opportunities for reinvestment, we would be very interested in pursuing those directions too. Because some of the decisions I think we made in the past, now if we apply rigorous research to them, we might want to redirect some of that funding to get a better result. Also, we would use this information and findings for knowledge spread. So that's very important. As Alex said, maybe we can apply this model across the province. So that would be very important for us, and that would be a big success coming out of this region. So congratulations, Al.
Thank you.
We look forward to working together with you.
Thanks a lot. Thank you.
Thank you.
Thank you, Alec, very much. So next I would like to introduce Dr. Ramon. He's from the London Health Sciences. He's the Chief of Medicine there, and he's also on the Board of Directors for the Care for Kidneys Foundation.
He makes the grand entrance.
They tried to lock me out. First of all, I want to thank Nicole and Dr. Kadri for inviting me to be here. I first met Al when I was a resident, a junior resident, starting at Western. We both trained there. And despite the fact that he looks much younger than me, he's actually much older than I am. So he's about 3 years ahead of me. And I actually got to know him quite a bit better when I started my nephrology training as a subspecialty resident. He was already on staff here in Windsor. And I ended up coming down here to do an elective with him. And I was so welcomed by all of the doctors, and at the time Dr. Art Kidd, I think, was one of the chiefs, and he made me feel welcome, Al made me feel welcome, and I thought, wow, this is a wonderful place to practice. And at that time I was kind of doing my rotation at Hotel du Hospital. And right from that moment, it was very clear to me about the quality of care that Dr. Kadri delivered to his patients. And I would observe him with patients. I followed him around in clinic. I helped manage his patients, and I was on call with him. And the passion that he has in terms of delivering excellent quality care to his patients can't be matched. And I started modeling some of my own clinical habits after him. Subsequently, I finished my training, and we became very close friends, and we started collaborating between the London Nephrology Program and the Windsor Nephrology Program. And before you knew it, the medical school opened in Windsor, and there was even more collaboration and excitement. And so we've been able to work very, very closely together. And one of the things I noticed about him is he's never satisfied. He always wants to improve the quality of care that we deliver to our patients. And whether that's by recruiting people that he believes in to Windsor, to great doctors who can come here and do great work for the citizens here, or whether it's having charity events to raise money for his patients. You know, I still remember the first Dunks for Dialysis that he organized, and I actually modeled a charity event after his, based on the success he had. This is one of the few clinics, this clinic you're sitting in, that is actually accredited by one of the highest high blood pressure societies out there, called the American Society of Hypertension. And I was a part of the external review that happened, and I don't believe there's any center in London that has that accreditation. So he always wanted to make the standard of care that he delivered the topmost standard that would be recognized by everyone. And so again, this is part of that journey. And when he asked me to be part of the Care for Kidneys Foundation and his mission in terms of improving care, it was a no-brainer for me. and I joined on the board, and I've been very honored to be part of it for a number of years now. Today's a very special day. I'm recognizing another individual who's amongst us, actually a couple, Michael Schlater and his wife Lilybeth Schlater, who are here with us today. I met Michael through Dr. Kadri, and one of the things about the Schlaters is that they're also very passionate about what happens in Canada with healthcare. Michael's from the United States, Lilybeth's originally from the Philippines, but I haven't met two more Canadian people in terms of their approach to life. Okay? And Michael himself has had a long journey. He's been through many things personally, professionally, many struggles, many successes. He's been through health issues with himself and with his family. And he understands the importance of everyone having equal access to healthcare. Okay? And through his company, Domino's Pizza Canada Limited, he has made millions and millions of dollars of charitable contributions to a variety of causes in Ontario especially, but throughout Canada. Okay? And that not only includes healthcare, but includes taking care of marginalized populations, helping people struggling with addiction, helping the healthcare system itself, helping the education system itself. Kind of almost every facet of our existence, he has, him and his wife have donated millions of dollars to those causes. And a lot of those causes you don't even know about are in Windsor or in Leamington, in the Windsor and Leamington area. So he cares about where he lives, where he comes from, and he's passionate about healthcare. And before I introduce him, there's just a wonderful announcement that Michael and Lilybeth Schlater are donating $1 million to this cause in order to establish this center in Windsor. So we're very grateful to them. I'd like to invite Mr. Schlater to come here and say a few words.
Wife for coming. We are on the road a lot for different charity stuff. I did hire somebody 4 years ago, August, to run the company, and that's all we do is charity now. Now, we did a lot of charity before, but nothing like what we do now. And it's so funny because I hear them use the word testing. Doc, you can confirm this. The money we do, 90% of that money we do is for different testing that the doctors and that are doing, because we know they can't get the money from the government to do it. So we give it to them because we want them to be able to find different cures to help it. We're not medical. We don't come and say, okay, find cures to this, find, okay, I'm a pizza guy. I never went to university, so I'm not sitting there, okay, doc, let's find a cure to this. So, but you know what, we just always stay very down to earth, and we made sure we did very, very well in this pizza world. And I started as a driver in Domino's in 1977 in Ohio. And I moved to Winnipeg and I opened that first store in 1983. And I've been in the pizza business ever since then. And you know, it worked out very well. We can't take the money with us. And so, you know, and I just adore my wife. And even though she yells at me in Filipino, I don't get that. I think she's just yelling, she loves me all the time. Is that, you think she does? We've been in your house. We've been in your house when she yells at me for stuff like this. And, we've known him for quite a few years now. And so, but you know what we do? I mean, that's the charity is what we're always going to stick with. And we do help them with the bigger stuff because, you know, we're very blessed. And I'm not trying to brag and say, oh yeah, look how rich we are. It's not that at all. We're just very, very blessed to be where we are. And so that's why we help the doctors. And you know, I just hope that as they go out and try to find the rest of this money, it is something that can really help Windsor look cool if you get the rest of this money. Because you know what it is all you've ever really seen all these last years is, well, look at Windsor, it's gone down because this, you know, the car went down, this Ford went down, and then Chrysler went down. But you know, here's something where you can really make the city really be proud and look first class. And man, for the government to give you the okay to go do it, I mean, all I can tell you is it can really make you look first class. So I just wish you all the best, and you know, I do sincerely wish you the best. By the way, you got a great wife. I don't know why she likes you.
So once again, we really truly are honored and grateful for your contribution, Mike and Lily Beth. Honestly, it's a really good start to our campaign. So we're kicking off our Caring Kiss campaign. So what this campaign is, we're asking people to give a caring kiss to someone they love, someone they want to see live a longer life in support of reducing the incidence of cardiovascular and kidney disease. So this is a wonderful kickoff to that campaign. So again, thank you, Mike and Lily Beth. So to finish it off, I'm going to bring up Dr. Kadri, who's going to say a few words, and then followed by some questions if anyone has any.
Thanks, Nicole. I want to start by thanking, Dr. Rahman, who we know dearly as King Faisal. Faisal's been a great friend to me ever since I met him many years ago. And a person could not ask for a better colleague, a better friend. And so Faisal, I just want to tell you I appreciate everything that you've done for me over the last 10 plus years, 15 years, as far back as it goes. You're right, I am a bit older than you. But honestly, I have the utmost respect for Dr. Rahman. Whenever we need someone taken care of in London, he's a phone call away. He's been a tremendous support for our patients, especially our kidney transplant patients, as he's part of the transplant program in London. And he's just been a great supporter of our community, even though he lives in London. Whenever we call on him, he's here. He helps teach the medical students and run the genitourinary block for our local medical students, and they all love him. We can't match him in popularity with the students. And so thank you, Faisal. And Mike and Lily Beth, I cannot tell you how appreciative we are that you're helping us to establish this institute, that you care so much. And I can tell you, Mike's right, we met many years ago. And I can tell you, what you saw is exactly what Mike is. He's a straight shooter, it's from the heart, and he cares about doing what's right for his community. And I think, looking around the room, honestly, that's what Windsor is. It's a community, it's a tight-knit community. Everybody knows everybody. Like we have one mall, and you go through the mall and you'll meet 2 or 3 people easily that you knew or grew up with, and a lot of people in this room I grew up with, and that's what it's about. I mean, it's an opportunity for us to help our community, and Mike, thank you for helping us do that.
Oh, you're more than welcome. I just wish you all the best.
We appreciate it. So with Mike's contribution, obviously Mike's contribution is the biggest contribution we've had, but with that, we have a total in pledged contributions of 2.5 million. And nobody knows that, we're announcing it today. But Mike, certainly you put us on the map. I mean, $1 million donation speaks volumes. It speaks volumes of your commitment to try and improve care in our community, and we can't thank you enough. And this is all about recognizing you today, so thank you again.
Can I say one thing?
Sure.
Where's that Faisal guy at? Are you still a doctor? Yeah. If anybody wants to say, I've known him for years, I've just known them 2 years, less than a year, you will confirm that $1 million will be a nothing to take care of. I don't mean it disrespectfully, but he sees all the donations that I do everywhere else year after year, and he sees the millions that go everywhere every year. You will confirm this $1 million will be, I don't want anybody going thinking, well, I wonder if that's going to show. Oh, no. I just want Faisal, you know where
we know where you're living.
I don't want anybody going, sometimes you get people, yeah, well, Faisal will confirm. So I have to go to his fundraiser on October 3rd. And notice, by the way, one last thing, I'm sorry to cut you off. You see his hair? I mean, I'm embarrassed.
Honestly, if I'd have seen that before.
I know. You see how honest I am? Okay, our wives love us because we're
line barber to take a little bit off the side.
He has another are on the 22nd of October, and thank goodness we do not have to go to that one. All right, that's it. I won't say that.
Well, thanks again.
All the best.
And thank you everybody for coming tonight. So, well, I know we've kept you here quite a while. It's probably hot. Everybody's in a tight room together. But if you have any questions, I'd be happy to answer them. If you want to mingle through the clinic as well, we're happy to entertain you here as well. So I'll open it up to anyone who'd like to ask.
Can we do one-on-one interviews?
Sure, absolutely. Sure, absolutely.
Help yourselves to food.
Oh, there's still lots of finger food
Feel free
too.
to come in and see the clinic if you would like.
Thanks
you,
again for
everyone.
coming.
Thank you.